What does covered actually mean when your insurance company says it? As one Missouri family discovered, it's not always straightforward. Chloë Jones was born with a droopy eyelid, a condition known as ptosis.
For kids, it can interfere with their vision. Chloe has an astigmatism that she had glasses for, so we didn't want any extra issues.
So when Chloe's doctor recommended that she see a specialist, her mother Kiana began searching for one near their home just outside of St. Louis. But she couldn't find a pediatric ophthalmologist nearby who was in network. She said the closest specialist was over 250 miles away in Wisconsin. This is Bill of the Month, a series in which we investigate medical bills sent in by patients like Chloe and her family. Kiana asked their insurer United Healthcare for a network gap exception. Under the exception, the insurer would allow a nearby out-of-network specialist to be covered as in-network. Before the surgery, the Joneses received 2 letters from United Healthcare, one approving a gap exception for certain services from Chloe's out-of-network doctor, and a prior authorization letter approving the surgery itself.
At that point, we thought, okay, you just move forward like normal people.
Chloe made it through the surgery without a hitch, and then the bill came. The surgery bill was roughly $15,000. Insurance covered just under $1,800.
At first, I was just like, it showed that they billed it as out of network. So I thought, oh, it's just a mistake. Mistakes happen.
But when Kiana contacted the insurer, the representatives told her they had no record of agreeing to cover the surgery as in-network. Turns out, the gap exception approved some of Chloe's doctor's services as in-network, but in its prior authorization letter, the insurer said only that it would cover her surgery without offering network discounts. Kiana kept detailed records of every interaction and filed appeals, but nothing changed. That's when Kiana's mom suggested she talk to her brother, Caleb Rowden, who had been a Missouri state senator.
I sent my brother a text and I said, hey, Caleb, like, this is what's going on. And then he's like, well, you need to talk to your representative. Like, that's what they do.
Rowden and Kiana contacted State Senator Travis Fitzwater, who represented Chloe's district. Kiana also filed a complaint with the Missouri Attorney General. Soon after, both the hospital and the insurer contacted Kiana.
I got an EOB that said I owed nothing. No copay, no anything.
The takeaway? Approval letters don't guarantee your insurer will cover the full amount. And if you hit a wall with billing disputes, contacting your elected representative can help. Fitzwater said his office did no more for Chloe than it would any constituent. Advocating for constituents is part of their job. Do you have a confusing or outrageous medical bill? Tell us about it in the link below.